Okay, welcome everyone to another social emotional workshop. Today we have Lisa Kaplan from Henry Ford Health Systems, and we're going to be talking about coping with stress under these current conditions of COVID-19. Lisa, welcome. We're so glad to have you.
Thank you. I'm happy to be here.
Good deal, good deal. I'm going to open up my screen and share to bring up the PowerPoint, and you can get started whenever you're ready.
Okay. Okay, so my name is Lisa Kaplan. I'm a social worker at Henry Ford Maple Grove Center in West Bloomfield. We are the inpatient and outpatient chemical dependency program for adults ages 18 and up, and outpatient for adolescents ages 13 to 18. And I run the community education department, and I'm also part of the clinical treatment team on the inpatient unit. So I'm here today to talk to you about dealing with COVID-19 and its aftermath. However, I'm not even sure there is an aftermath because it's still ongoing. Indeed. So because of that, there's a lot of stress and anxiety. So if you want to flip to the next page, next slide. Okay, so this is an uncertain time for all of us. None of us have ever lived through a pandemic before, and we want it over. Okay, pandemic fatigue has absolutely set in. So it's normal for anyone to be anxious, angry, sad, helpless, hopeless, and fearful about things that are unpredictable and uncontrollable, and about the unknown. So if you're feeling this way, accept your feelings as real and universal. You're not the only one who feels this way. So you want to acknowledge your feelings of loss. We've had loss over our routines, our activities, contact with our family members and our friends. Some of us know people who have been sick or may have passed away, and depression is a very natural response to loss. So we want to allow ourselves to feel our feelings and communicate them with others, and take things one day at a time. That's really good advice for anybody who's dealing with any kind of problem in life, one day at a time. We want to have realistic expectations of ourselves and others. You may meet people who are less tolerant. Wait, you want to go back one slide? Thank you. You may meet people who are less tolerant and more difficult to get along with because they too are struggling, and it's coming out in their behavior and in their interpersonal relationships. And remember, before the pandemic ever hit us, every day we lived with uncertainty. We drove our car, we flew in an airplane, we had uncomfortable conversations, we ordered food at a restaurant. So we did activities every day with uncertainty. The advantage to us to accepting some lack of control when the pandemic will end is that we can focus on the behaviors that we can control. We can't focus on what we cannot control. So next slide. So some people have been diagnosed with mental health disorders like anxiety and depression, and some people with COVID, because of the COVID-19 crisis, it has made this much worse. But some people never had a mental health disorder prior to COVID, yet they've developed symptoms during COVID. And at the end, we're going to talk about how to help yourself or others. So fear, isolation, exposure to illnesses and death, and the unknown have impacted everyone. And we're all concerned about how long will this go on? Are our lives forever changed? Are there new strains of the virus that are going to continue to come forth? Should we or should we not get the vaccine and the booster? Where some people are uncertain about the vaccine's effectiveness and how long it'll last. And some people are concerned about getting sick before getting vaccinated. All common concerns for all of us. It can increase feelings of stress, anxiety, and depression. So we have to accept the fact that some people are going to make unsafe choices, which may jeopardize all of us. We may not be able to trust our own family and our own friends. And I will say for myself, one of my very best friends is taking high risks, and, I just have to protect myself. So we have to accept the fact that our government leaders make decisions which we may or may not disagree with, but we have to live with it. But we all have choices on how to cope, which will affect the emotions that we deal with daily. So over the past year plus, almost 2 years now, we've all been resilient. We've adapted to challenges that we're facing. We've used many, many coping skills, maybe not even being aware that we're using these coping skills. But these coping skills that we're going to talk about upcoming will serve as a reminder, and maybe you'll pick up something that you have not tried before. So the next slide. So coping skills are things that we and kids can use to manage stress and anxiety. They're in no particular order, but if you use coping skills, you feel like you have more control over your life, and it should decrease the anxiety. So as silly as this sounds, focus on your health. Eating right, sleeping well, drinking water, exercise, yoga, stretching, weightlifting, all of these things improve our health and help to protect us from the virus. If you're in good health, you're less likely to be as sick. We want to follow the good health practices that we've all heard about, about the masking and the social distancing, obviously, continuing to take medications, see our medical professionals, and making health a priority, because I'm sure everybody would agree that good physical health positively impacts our mental health. And staying up to date on the recommendations of the CDC and the World Health Organization and other trusted sources of information. We're going to hear information from everywhere, but determine what you see are the trusted news sources. And as you know, the situation changes regularly. If you watch the news, you will see that every day there's something new. So we want to limit our access to social media and the daily news if they increase anxiety, because they're always talking about negative things like businesses closing and financial problems, politics, protests, and news stories that can be very depressing. So even taking a break for a day or two can be helpful, and limiting conversation with others about these topics can also be helpful. So I will tell you, during the 2020 presidential campaign, I couldn't handle any more negative advertisements or commercials. I ended up turning off the TV and not listening to the radio, and it really helped me. Another coping skill is following a daily routine, getting up, getting dressed, even if you're working from home, wearing makeup, paying attention to your hygiene, eating regularly scheduled healthy meals, and scheduling activities to keep busy. So for many people, we've been doing that, but just a reminder. And we want also to take advantage of technology to adapt to activities that we enjoy and not just work. So you can play games online. People hold birthday parties, religious services. Some people will be holding Zoom Thanksgiving dinner in a couple days. Exercise and cooking classes. I know I take a bi-weekly yoga class online. Book clubs, support groups, and reunions. My high school friends held a reunion on Zoom. So these are really great ways to safely connect to others. Reading stories, playing games, coloring, and chatting with grandchildren or nieces and nephews on Zoom. So if you're already doing these things, think about ideas or ask for ideas from other people on what activities they have worked for them, because having fun is incredibly important to our quality of life, always, but especially during a pandemic when there's less going on in our communities and we may feel a little more isolated. So another coping tool is to stimulate your mind, challenging yourself with not just work, but things like crossword puzzles or word games, reading a classic, watching Jeopardy. My family, we are Jeopardy geeks. We love it. Learning a new language or playing an instrument that will help you to stay sharp mentally. And don't isolate. Using the phone and the computer to remain in contact with family and friends. You will help yourself, of course, but you will also help them. And seeing people more at a distance, contacting people who live alone to check in on them, using Zoom and other platforms to see others, walking outside if the weather cooperates or inside a mall. I will tell you all last winter, unless it was too icy, I went outside for an hour-long walk every day, bundled up and went. It was cold for the first 5 minutes. After that, I was warmed up. So next slide, please. Using deep breathing, mindfulness, and meditation. So I don't know if you've heard a lot lately about mindfulness and meditation, but these are not just buzzwords. Mindfulness teaches you to be present in the moment and not focus on the past or the future without judgment. So focusing on the here and now. Meditation is calming and relaxing. So guided imagery is one form of meditation. You can go in your head to your happy place in your thoughts at any time. So let's say your happy place is the beach. You can go to the beach and think of the sights and the sounds and the smells. So if you have a smartphone, there are apps you can access to help guide you through this, but you don't necessarily need that. You can just imagine on your own being in your happy place. And another one is progressive muscle relaxation. So starting with your head and heading downward, tightening and loosening each muscle group one by one, holding and releasing. And these activities are scientifically proven to reduce stress and anxiety, lower your blood pressure, and improve your quality of life. So I will tell you, I work at a drug rehab, and we teach these skills to our patients, and they really work. Now, is it going to work the first time you use it? Maybe not, but you need continued practice and it will get better. Another tool is journaling, either on paper or on a computer, as long as it's private, to get your thoughts out of you and allow you to review them at a later time with a different perspective. So people who ruminate over problems, people who continually obsess over problems, if they get it out of their head onto paper, it gets it out of them, and at a later time they can read it back and maybe see things differently. Some people have trouble sleeping. If you keep a notebook next to your bed, jotting down your thoughts can help you fall asleep. So if you're thinking, oh, I forgot to pay this bill, or I need to call someone back and I forgot, you can write it down. It'll be there in the morning and you can sleep. Another tool involves touch. If you live with others, giving and accepting a massage. Human contact is important and helpful in reducing stress, and it feels good. Some people feel safe enough to go to a massage studio. I know that you can wear a mask, you can wear a shield, and you can ask the massage therapist to do the same, and it can be safe as well. So next slide, please.
I switched.
Okay, so using positive self-talk only, okay? Telling yourself that you're okay and functioning reasonably well is less anxiety producing than gloom and doom talk, okay? So saying to yourself, I'm all right, I'm focusing, I'm handling things. Today I'm doing all right. Some days will be easier than others, but make efforts to be positive because that will reduce anxiety. And recognize when you have negative thinking and challenge that. Okay, recognize when your thoughts may be an exaggeration and replacing them with reasonable and reassuring thoughts and avoiding what if thinking. What if this happens? What if that happens? I'm so worried about this or that. The better way is this has not happened. I'll deal with it when it happens. And if it happens, and many times it won't happen, and talking yourself down. Consider doing volunteer work, things like delivering Meals on Wheels and volunteering for a crisis center, calling seniors who are isolated are some ways that you can give back and stay busy in a safe way. I know when I was furloughed from work, I had a list of my friends' parents who were elderly and living alone and pretty much isolated. And I would call them once a week just to give them the feeling that someone's checking up on them. And it made me feel good. So it helped me as well. Alternatively, baking cookies or preparing a meal for a friend or a neighbor and doing random acts of kindness. Those are things that will help others, but they also make you feel good. And connecting with nature is really important. Walking through the woods, going to a park, driving to a lake or river, sitting outside, just dress warmly, stay outside as long as you can, because fresh air and a change of scenery can really improve your psyche. And practice gratitude, especially this week. Many people are going to be thinking about what are they thankful for, but I'm advocating for expressing gratitude every single day, even when it's not Thanksgiving. So making a gratitude list, stating 3 things you're grateful for before you go to sleep at night. It could be as simple as a roof over your head and food on the table. Writing a letter or emailing or calling someone in your life, expressing your appreciation for their support. I recently wrote a letter to my high school English teacher who became a Facebook friend, letting her know how her how teaching me writing skills has impacted my career. It really gave her great joy. When you give the gift of thanks, you are likely to feel better too. So it goes both ways. So it's natural to worry about others. We all have family members that may be under great stress with their job, managing school for their children, especially when kids are in and out of school because schools close or because they're quarantined. So our children have missed out on a lot. They've missed out on in-person school, camp, sports, and other activities. You may have a spouse who's sad and complaining about boredom. You can be a sounding board for others in your life, but if it begins to negatively impact your own happiness, then you might need to set some boundaries. So I might need to say to my husband, honey, I'd really like to help you with this, but I'm all out of ideas. Who else can you talk to? Because talking about this repeatedly has brought me down. Who else in your life can be a sounding board? Okay, and that's not mean and that's not rude. That's taking care of yourself. Be very, very careful about using alcohol and other drugs to cope. Okay, while it might work initially, it's likely to be harmful over time. And substances stop working as a coping mechanism in a very short period of time, and addiction can develop. So I'll tell you, where I work at our inpatient treatment program, we are aware that because of COVID, the amount of people needing help for addictions has skyrocketed. Unfortunately, so have overdose deaths. So coping with substances is not the answer. Remember that even though this is a challenging time, we want to focus on the fact that we are okay. And we have successfully navigated this for almost 2 years. And vaccines are available now for anyone who wants it, and things are looking up. So utilizing a coping skill that has served you well in the past or trying something new can definitely help you get through the upcoming months. So now let's talk about what to do as we move forward. We all want this to end, okay? And as the end approaches, many people have stress or anxiety that they did not anticipating happening. We thought we'd be overjoyed as things got better, but life will not return to normal, okay? Instead, there will be a new normal. And many people have become accustomed to their lives during the pandemic and may have anxiety about reacclimating. I know for me, when I went back to work, I was scared of everyone. I was home in my safe little bubble, and now I had to be with people. It took some adjustment. So social skills may be weak, and others are fearful of losing the positive changes they've made in their lives over the past year. Working from home may not be an option for those who want it, or some people are required to work from home and they would rather go to the office. Some people feel a false sense of security. They may not believe the pandemic is somewhat under control, or they may fear that a new pandemic would develop. And those are very realistic fears for both sides. There may be anger toward family and friends who choose not to be vaccinated. We may not agree, but we want to remember to always remain respectful. Family relationships and friendships may have changed. Because of too much time together, divorce has increased, domestic violence, child abuse, all of these have become more prevalent. Friendships have ended over political differences. There may be feelings of grief and loss because of this. So we want to remember to respect the boundaries of others. Don't impose your level of comfort on others, and be honest if you feel unsafe. Okay, my friend who I feel very differently about related to anything political or pandemic related, we have agreed to support each other and not discuss it. So when we're together, we're outdoors and we wear masks, just to make both of us comfortable. So we want to understand that some people have experienced trauma from the pandemic, and trauma doesn't go away. Change is hard, even under good circumstances. Adjustment takes time. So we want to be kind and gentle with ourselves and with others. And some people will feel more comfortable as they gradually get reintroduced to the new way of living. So we always want to reflect on how far we've come and the challenges that we've overcome. People are resilient. Most people have done very, very well in spite of this. However, others may have lingering psychological problems. So let's talk now about how do you help yourself or someone else? How do you know when you should be concerned? So let's talk about some signs indicating that a person is not functioning well. So deteriorating self-care, which could mean poor hygiene, stopping exercise, sleeping or eating too much or too little, not taking their medications. These are red flags. These are definitely things to be concerned about. People who withdraw or isolate from others, they no longer experience joy participating in activities. They withdraw from friendships and family and social interactions. This is an area of concern. And people who have a sense of hopelessness, even when things are getting better. So how would you know that? There's a negative content to their speech. There's a sense of doom and gloom. Everything seems to be negative. Unexplained physical problems. So if people have headaches, stomach aches, or physical pain that are not explained by a medical problem, they have what we call psychosomatic symptoms, and that is an area of concern. Someone who loses their motivation or ability to concentrate, they can't focus, their day kind of goes by not doing anything productive, maybe just watching TV. Okay, that's someone who's struggling. Of course, increased use of alcohol or other drugs, and suicidal thoughts, threats, and attempts. So what do you do about that? If someone is talking about suicide, outright asking them, are you feeling suicidal? Have you thought about hurting or killing yourself? So most people balk at having that conversation, but the truth is, if you bring up the subject, you are not going to be planting an idea in somebody's head if the idea wasn't already there. But asking the question can give them the feeling that it's okay to talk about how I'm feeling. And if they feel like it's okay to talk about it, then they can ask for help. So being brave enough to have those conversations is really important and may be a huge sign of relief to the person that you're speaking to. So how do you access help? Help is available. There is nobody who is beyond help. There is nobody who can't be helped. So it's a sign of strength to seek help, not a sign of weakness. Many of us remember back in the day that when anybody needed any type of mental health help, you were thought to be crazy. Thankfully, things are not like that anymore. And this is a silver lining of the COVID-19 crisis. Unfortunately, many, many more people are looking for help for mental health and substance abuse problems, but it's also normalized the need for help. It's made it okay to seek help. So that's the good thing. So there has been a reduction in the stigma against getting help for these problems. And if you have never needed help in your life and now you do, you are in good company. As I said, the number of people seeking and needing help during the COVID-19 crisis has grown exponentially, and you are not alone. So what type of help is available? Well, treatment can be provided by a psychiatrist who's a medical doctor who specializes in diagnosing and treating people with mental health disorders, and or a therapist, which is most likely a social worker, a psychologist, a licensed professional counselor. And they cannot provide medication, but they can do talk therapy. A psychiatrist can provide medication. Some people will need only talk therapy, but most people will need therapy and some type of medication, at least in the short term. So some people need inpatient treatment for mental health and substance abuse problems, and this is accessible as well. So if a person has private insurance, it usually covers all or part of a person's treatment, and a primary care provider can refer you to providers, or you can ask for recommendations from family and friends, or your insurance company can refer you to providers as well, simply by calling the customer service number on the card. But what if you don't have private insurance? There's help for everybody. So every county has a pool of money available to help people who are either indigent or on Medicaid. And all you need to do is access your community mental health in your county for help. So I know that in Oakland County, it's the Community Mental Health Network. In Macomb County, it's Macomb County Access. In Wayne County, I believe it's the Detroit Mental Health Authority, or they've recently Integrated Health Authority. I think they recently changed their name. So regardless of what county, there is help available. Or you can contact me. That is my direct number at work, and I am happy to talk to anybody about anything confidentially. I can direct you to treatment providers as well. Just be aware that if you were to call me, I only work part-time, so I will return your call, but it may not be as soon as you would like. So if it's a crisis, you certainly want to call a crisis center. So like any other medical care, your mental health and substance abuse treatment is covered by HIPAA laws, privacy laws, just like if you went to a doctor, your medical records are private. So remember that there's no reason to struggle when professional help is available and effective. So you want to share that with your family, your friends, your students, and their parents, because anyone can be helped. And on that note, I think we'll open it up to any questions or comments that Tony will be managing.
Okay, I am going to stop sharing my screen so that I can see you guys when you raise your hands and ask questions. Anybody got any questions or comments? Want to share? It was an excellent presentation, Lisa.
Thank you.
A lot of information, a lot of really good information that, you know, you don't even really consider, because
Right.
this is an experience that, you know, none of us are really familiar with, you know.
That's for sure.
Nobody has any comments, questions? Please feel free to raise your hands and I will happily unmute you.
So Tony, I'm wondering if anybody has anything to add that I didn't cover that maybe I could use in a future presentation.
You guys have anything you want to add? You want to share? It appears we're dealing with a shy bunch today, Lisa.
Okay. Well, I hope your shy bunch has a great day. I hope this information was helpful to everybody. and hope to see you again.
Absolutely, you guys. Thank you for joining. Thank you, Lisa. Again, it was an excellent presentation, and I'll see you in a few weeks on anger management.
Yes.
Good
Okay,
deal.
thank you.
All right, bye. Everybody have a great day now.